Hey guys, welcome back for question of the day. This week is Pharmacology week, so let's get right into it. Our question says, the nurse has taught a client with hypertension who has a new prescription for Ramipril. Which of the following statements by the client would require follow-up? So we are looking for a statement that is incorrect that we would want to, provide some more teaching about. So let's look at option 1, which says, I should discontinue the medication if I develop swelling of my lips or eyes. This is a correct statement, so it is an incorrect answer choice. ACE inhibitors like Ramipril can cause angioedema, which is going to be that swelling of the lips, eyes, face. Very uncomfortable. It can be very dangerous, especially when we talk about like airway involvement and those kind of things. So if a client develops that, we definitely want them to notify their healthcare provider, and they should stop taking the medication. So option 2 states, I will avoid taking a potassium supplement with the medication. Again, a correct statement, but an incorrect option choice. Ramipril, when used in conjunction with like potassium supplements, potassium-sparing diuretics, increases the risk for hyperkalemia, which then increases our risk for like cardiac arrhythmias and other things. And same thing, like we don't want them to consume a bunch of salt substitutes, which are pretty common for clients with hypertension to use. So we do want to educate them to avoid that risk of hyperkalemia. So again, not our correct option. Option 3 states, I can continue taking the medication if I become pregnant. This is our correct answer because we need to stop taking the medication if we become pregnant. ACE inhibitors, Ramipril specifically, can cause renal dysfunction to the fetus in utero. And even like breastfeeding, we want to be very careful, passing that through breast milk to an infant as well. So we want to make sure these clients talk to their doctors if they're trying to become pregnant, because an ACE inhibitor probably isn't the right medication for them. And then option 4 states, I may develop a dry cough while taking the medication. This is a true statement, so an incorrect answer. The dry cough with ACE inhibitors is pretty classic. It's not harmful, but it is really annoying. And so a lot of times clients will stop taking their ACE inhibitor because they don't want to deal with this cough, and rightly so, right? Like none of us want to be coughing all the time. So there are other medication choices. Sometimes like a beta blocker, could be used instead. There are other options. So we just want to encourage clients to report that dry cough and let the healthcare provider know before they stop it themselves. But yeah, option 3 is our correct option here, and we will see you guys tomorrow for another pharm question.